My name is Caitlin Venosi, and today I'll be talking about child rearing during the COVID-19 pandemic. According to the World Health Organization, COVID-19 is the disease caused by a new coronavirus. COVID-19 spread rapidly around the globe, showing an increase of cases and death beginning in December 2019 and is a pandemic. SARS-CoV-2 is the virus that causes COVID-19. The exact origin of the disease remains unknown. However, the first reported cases were traced to Wuhan City, Hubei Province, China. The COVID-19 pandemic still has many unknowns. The information spanning between the first cases reported in December 2019 and now has not changed drastically. However, it's now understood that the virus often mutates. After 451,000 deaths reported in the United States alone, COVID-19 is taken much more serious by the general public than it was during the initial outbreaks. COVID-19 symptoms include, but aren't limited to, fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea, or vomiting. Pregnancy causes physiological changes that may increase infections and severe symptoms when infected with viruses similar to COVID-19. Pregnant women account for a substantial proportion of COVID-19 associated hospitalizations among women of reproductive age. It's still too early to determine exactly how COVID-19 affects pregnant women and their babies. Studies have shown that the risk of passing the infection to a fetus appears to be very low. According to the CDC, 1 in 4 women between the ages of 15 and 49 who had a COVID-19 associated hospitalization during March 1st to August 22nd, 2020 was pregnant. The CDC also found that approximately 50% of women who were asymptomatic upon hospital admission. The COVID-19 pandemic is taken very seriously by the medical community. Treatment is not well understood initially. However, COVID-19 positive patients now receive remdesivir as the best treatment. Physicians have stopped treating COVID-19 patients with hydrochloroquine. Pregnant patients have been found to be at higher risk of severe disease and worse outcomes from COVID-19 than non-pregnant peers. This includes intensive care admission requiring ventilator and death. Data is still evolving. However, adverse pregnancy outcomes such as preterm birth for COVID-19 positive patients have been reported. According to the CDC, an increased risk of fetal malformations have not been documented in pregnant women who are infected with COVID-19. Therefore, pregnant women who become ill with COVID-19 do not have an increased risk of miscarriage. The CDC recently published a study on 598 hospitalized pregnant women with COVID-19. 12.6 of births were preterm, earlier than 37 weeks, higher than expected among pregnant women in the general population. There is a low chance of miscarriage. It's been reported that the spread of COVID-19 has caused increased stress and anxiety among pregnant women. As an abundance of caution, an expectant mother, even being COVID negative, is required to attend routine prenatal doctor visits alone, without their partner, throughout the duration of the pregnancy. Hospitals are currently requiring expectant mothers wear a mask while giving birth. Hospitals have implemented safety measures such as limiting visitor policies. During birth, mothers are allowed only one guest in the delivery room for their entire hospital stay. The CDC maintains that identifying COVID-19 during birth hospitalizations is important to guide preventative measures to protect pregnant women, parents, newborns, other patients, and hospital personnel. The International Journal of Gynecology and Obstetrics published a study that reported higher levels of stress during childbirth and a higher percentage of postpartum depression in women who gave birth during the pandemic. There are now 2 vaccines readily available in the United States. Currently, pregnant women and babies are exempt from being able to receive the COVID-19 vaccine.